Neglected tropical diseases, or NTDs, afflict millions in tropical and subtropical regions worldwide. These diseases often prey on the poorest communities, perpetuating a cycle of poverty and ill health. In this video, we'll explore some of the most significant NTDs, their symptoms, prevention strategies, treatments, and where they are most prevalent. Let's start with dengue fever. Dengue fever is transmitted by mosquitoes and is characterized by high fever, severe headache, joint pain, and a rash. Prevention involves vector control, such as eliminating mosquito breeding sites and using mosquito nets. Treatment focuses on supportive care, as there is currently no specific antiviral treatment available. Next, we have Chagas disease, also known as American trypanosomiasis. It's caused by the parasite Trypanosoma cruzi, spread by triatomine bugs. Acute symptoms include fever and swelling at the infection site. Prevention includes vector control and screening of blood donors to prevent transmission through blood transfusions. Antiparasitic medications are used for treatment, particularly effective in the early stages of the disease. Moving on to leishmaniasis. This disease is transmitted by sandflies and presents with skin ulcers in the cutaneous form and fever and organ swelling in the visceral form. Prevention involves vector control, protective clothing, and avoiding outdoor activities at night. Treatment includes antiparasitic drugs, tailored to the type and severity of the disease. Now, schistosomiasis, also known as bilharzia. It's caused by parasitic worms and is transmitted through fresh water contaminated with snails carrying the parasite. Prevention focuses on improving access to clean water and sanitation, as well as controlling snail populations. Praziquantel is the primary treatment for schistosomiasis, effective against adult worms. Next, lymphatic filariasis, also known as elephantiasis. Transmitted by mosquitoes, it leads to lymphatic system damage and swelling of limbs, known as elephantiasis. Prevention includes mass drug administration and mosquito control programs. Treatment focuses on antiparasitic medications and managing symptoms and complications. Moving on to trachoma, a leading cause of preventable blindness. It's caused by a bacterial infection spread through eye secretions and poor hygiene practices. Prevention includes promoting facial cleanliness and improving hygiene practices alongside antibiotic treatment. Antibiotics like azithromycin or tetracycline are used for treatment, with surgical intervention in severe cases. In addition to these diseases, several other neglected tropical diseases also pose significant health challenges. These include guinea worm disease, human African trypanosomiasis, sleeping sickness, onchocerciasis, river blindness, soil-transmitted helminthiasis, Buruli ulcer, yaws, and snakebite envenoming. Each disease requires specific strategies for prevention, such as vector control, improved sanitation, and access to health care. Treatment options range from antiparasitic medications to surgical interventions, depending on the disease and its progression. By raising awareness, investing in research, and supporting affected communities, we can work towards eliminating neglected tropical diseases by 2030. At Medi platform, our goal is to educate the public about neglected tropical diseases, NTDs, as well as other health-related issues. Please visit our channel regularly for comprehensive information on each disease and share it with those in need of treatment and prevention.